Hydrops Fetalis. It's one of the most serious conditions a baby can face before birth. It's a really complex and, let's be honest, often heartbreaking diagnosis. It's kind of like a final common pathway for a whole bunch of different underlying problems. So in this explainer, we're going to break down what it is, what causes it, and what the outlook is for these incredibly vulnerable babies.
Okay, so here's our game plan. First, we'll get down to the basics. What is this thing? Then we'll talk about the two main types. After that, we dive into the detective work of finding the cause, how it's diagnosed, and what factors can predict the outcome. And finally, we'll cover what can actually be done about it.
So let's start at the very beginning. When a doctor sees signs of hydrops on an ultrasound, what are they actually looking at? What does this condition really mean?
At its absolute core, Hydrops Fetalis is all about a problem with fluid balance. We're talking about a dangerous, abnormal buildup of fluid in places inside the baby's body where it just should not be. And I want to be clear, this isn't just a little bit of swelling. It's a major systemic issue that can completely overwhelm a baby's developing organs.
And this number 2 is so important. It's the magic number for an official diagnosis. The fluid has to be found in at least 2 separate, distinct parts of the baby's body.
So, where does this fluid actually show up? Well, it can be seen as major swelling of the skin, which has a medical name, anasarca, or it can fill up the abdomen, that's called ascites, and really critically, it can collect around the vital organs, like the lungs or the heart. You can imagine that fluid literally puts pressure on the lungs, making it hard for them to grow, and it puts this immense strain on the heart, which is a huge part of the danger here.
So you're probably wondering, what causes this scary fluid buildup? Well, that's the tricky part, because hydrops isn't just one thing. It's split into 2 major categories, and figuring out which one it is, well, that is absolutely crucial. It changes everything.
Think of it like a fork in the road. On one path, you have immune hydrops. This is a classic story of the mom's immune system getting confused and attacking the baby's red blood cells. The most famous example is Rh disease. This attack causes severe anemia. The baby's heart has to work way too hard to keep up, and eventually it starts to fail, causing all that fluid to build up. The other path, nonimmune hydrops, is basically the catch-all category for, well, everything else. And the list is long. Heart defects, genetic issues, infections, dozens of things.
Now here's where the story gets really interesting. A few decades ago, immune hydrops was the main cause, but then came this incredible medical breakthrough, a shot called Rogam that can prevent most of these immune reactions. It was a total game changer, and because of it, the situation has completely flipped. Today, about 90% of all cases are non-immune.
And that brings us right to the biggest challenge in all of this. For those 90% of cases, if it's not an immune reaction, what in the world is causing this dangerous fluid buildup?
Answering that question is like a medical detective story. It's a massive process of elimination, where doctors have to sift through a huge list of suspects to find the one true cause.
And this chart, wow, it really puts the scale of that puzzle into perspective. We can see that heart problems are the biggest known cause, making up almost 22%. Then you have genetic syndromes, blood disorders, infections, they're all major players. But look at that huge slice, nearly 18%, labeled idiopathic. That's just a medical term for we don't know. Even after all the tests, the cause remains a total mystery.
I mean, just look at the sheer variety here. It's staggering. It could be a problem with the baby's heartbeat, a genetic condition like Turner syndrome, a common virus the mom catches during pregnancy, or even a complication that happens only in twin pregnancies. So many different paths can all lead to the exact same devastating outcome, hydrops.
Okay, so with this crazy long list of possibilities, how on earth do doctors figure out what's going on? And maybe even more importantly, once they know it's hydrops, are there any signs that can help predict the baby's chances?
The whole diagnostic process works like a funnel. You start broad with a really detailed ultrasound to see the fluid and look for any big structural clues. Then you get more specific. Doctors can use special Doppler ultrasound to check for anemia without even using a needle. Then come blood tests for mom to check for infections or antibodies. And finally, if they still need answers, they might move to more invasive tests like an amniocentesis to get a sample for genetic testing.
And there's a really good reason for this urgent, thorough search. This is a tough statistic to see, but it's the reality of this diagnosis. Overall, the survival rate is about 50-50. It's an incredibly serious situation.
But, and this is a big but, that 50% number isn't the whole story. It's not just a coin flip. The outcome really depends on the specific cause and a few other key factors. Researchers have dug deep into the data to find the strongest clues that can help predict what's going to happen. And what they found is that it really boils down to two critical things. First, how early in the pregnancy the hydrops appears. The earlier it's found, the tougher the outlook. And second, and this one is a huge deal, how much fluid there is and where it is. If a baby has fluid in 2 or more of those big body cavities, say around the lungs and the heart, the risk of mortality goes up by nearly 13 times. That is a massive, massive factor.
So, all of this, the type, the cause, the predictors, it all leads to the one question that really matters to any family in this situation. Can anything be done?
The approach here is all about treating the underlying cause, if you can find it. If the hydrops is from severe anemia, sometimes doctors can give the baby a blood transfusion right there in the womb. It's incredible. If it's a dangerously fast heart rate, they can give medication to the mom that crosses the placenta and fixes the rhythm. If fluid is crushing the lungs, they can sometimes place a tiny drain. So yes, in some cases, treatment is possible, and it can even reverse the hydrops.
But here's the catch. All of those amazing treatments depend on finding a specific, treatable cause. And the tough reality is that even with all our modern technology, that's not always possible. For up to 30% of cases, a clear cause is never found.
So, after all this, what's the biggest takeaway? It's that despite these unbelievable advances in fetal medicine, a huge piece of the puzzle is still missing.
And that's really the bottom line here. These idiopathic cases, the ones we just can't explain, that's the frontier. That's where the next big breakthroughs have to happen. Figuring out what's going on in these mystery cases is the key to offering more answers, developing new treatments, and ultimately giving more hope to families who are facing this profound challenge.